If you're a guy over 60 and you masturbate, you need to hear this. Because what you're doing in the privacy of your bedroom might be reducing your risk of prostate cancer by up to 33%. But there's a catch that nobody's telling you about. 2 weeks ago, a patient walked into my clinic here in Toronto. Let's call him Robert. He's 68, retired from the TTC, and he looked at me with this mix of embarrassment and worry I've seen hundreds of times in my 20 years as a urologist. Dr. Brooks, he said, shifting uncomfortably in his chair, I need to ask you something, but I don't know how to start. And right there, I knew exactly what he wanted to talk about. Something almost every man wonders about, but few have the courage to ask their doctor. I'm Dr. Natalie Brooks, and I've been treating men's health issues right here in Canada for over 2 decades. Today we're going to talk openly, no embarrassment, no beating around the bush, just like we're alone in my consultation room, because this information could literally save your life. Robert's question was simple but loaded. Does masturbation cause prostate cancer? Or does it prevent it? Because I've heard both and I'm confused. And honestly, he had every right to be confused. The internet is full of conflicting information, and even some doctors avoid this topic because it makes everyone uncomfortable. But here's what the science actually says, and it's going to surprise you. Let me start with the biggest study ever done on this topic. Harvard University followed nearly 32,000 men for 18 years. Think about that. 32,000 guys, almost the population of Cornwall, Ontario, tracked for nearly 2 decades. And what they found changed everything we thought we knew about prostate health. Men who ejaculated 21 times or more per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times monthly, 33%. That's massive. That's like cutting your risk by a third just by maintaining regular sexual activity. And here's the kicker that made Robert's eyes go wide. It didn't matter how you achieved that ejaculation. With a partner, through masturbation, morning or night, alone or together. The protective effect seemed to be tied to the physical act of ejaculation itself, not to romance, not to having a spouse, not to anything else. Just the simple biological act. Robert looked at me, and his whole demeanor changed. Dr. Brooks, I'm a widower, he said quietly. Does that mean I'm doomed? No, Robert, I told him. Your health doesn't depend on having a partner. It depends on taking care of yourself. And I saw hope light up in his eyes. Now, before everyone rushes off to hit that 21 times a month target, like it's a hockey stat, let me be crystal clear about something. That number isn't a prescription. It's not a goal you need to force yourself to meet. It's not a competition with your buddies at Tim Hortons. Health doesn't work like that. The ideal frequency for each man is completely personal. It depends on your age, your overall health, whether you have a partner, your energy levels, your medications, your stress. Even the Canadian winter blues can affect libido. The list goes on. Forcing yourself to hit a number can create anxiety, stress, frustration, and that's counterproductive. The cure becomes worse than the disease. What these studies are telling us isn't that we should become machines. It's that a sexually active life, a regular ejaculation frequency, appears to be part of a healthy lifestyle that protects your prostate. The key, and I told Robert this, is to listen to your body. Find your own rhythm. No pressure, no guilt, no comparing yourself to anyone else. But why does this work? What's the mechanism behind this protection? Well, the scientific community has several theories, and they're fascinating. The first and most intuitive is what we call the flushing hypothesis. Think of your prostate like a sponge with tiny ducts running through it. Over time, potentially harmful substances, carcinogens from the environment, from tobacco if you smoke, from processed foods, can accumulate in your prostatic fluid. Each ejaculation works like a rinse, a flush that expels these substances before they have time to damage your cells. If you don't ejaculate frequently, these toxins stay in contact with your prostatic tissue longer, increasing the chance they'll cause mutations, changes in your DNA that could eventually lead to cancer. It's like doing the dishes. Leave them dirty too long, bacteria grow, they stick, they become hard to clean. The second theory involves hormones. Regular ejaculation might help maintain a healthier hormonal balance within your prostate, regulating testosterone and other androgens. When these levels are balanced, cell growth stays under control. But when they get out of whack, cells can start growing unchecked. And that's where problems begin. The third idea, and personally I find this one brilliant, is that sexual activity acts similarly to physical exercise. It stimulates your immune system, that army of defenders we have inside us. And your immune system doesn't just defend against viruses and bacteria, it also fights cancer cells. An active, alert immune system is better at detecting and eliminating abnormal cells before they become a serious problem. And finally, the muscular contractions during orgasm, those rhythmic, powerful contractions, improve blood flow throughout your pelvic area. This reduces local inflammation, decreases oxidative stress, that silent enemy that ages our cells. All of this creates an environment less conducive to cancer development. Now, a question I get asked constantly, especially by men who've already had prostate issues. What happens to my ejaculation if I have surgery? Let me tell you about another patient. Let's call him Tom. He's 72 from Mississauga. Came to me because he couldn't sleep anymore. He was getting up 6-7 times a night to pee, and when he did, barely anything came out. It was torture. This is benign prostatic hyperplasia BPH, where your prostate grows and grows until it squeezes your urethra, making it difficult to urinate. In these cases, surgery aims to clear the blockage. We remove the inner tissue causing the obstruction, but leave the outer capsule of the prostate. It's like peeling an orange from the inside, but leaving the peel. And here comes the most common consequence, retrograde ejaculation. What does this mean? During orgasm, instead of semen being expelled outward, it goes backward into your bladder. This happens because during surgery, we sometimes alter that little valve, the internal sphincter, that normally closes to prevent this. It's like a door between two rooms that doesn't close properly anymore. And here's what's crucial. You'll still have orgasms. The sensation of pleasure will be exactly the same. Your erections shouldn't be affected. You just won't see semen come out. Tom looked worried when I explained this before his surgery. Dr. Brooks, does that mean I'm not a man anymore? No, Tom, I said, taking his hand. You're still the same man. Your body just works a bit differently. The semen that goes to your bladder doesn't cause any problems. It's eliminated harmlessly with your urine. It just takes a different route out. That's all. Many men adapt perfectly to this, and their sex life continues to be satisfying. Some guys even joke about the no mess benefit. But the second type of surgery is very different, much more radical. It's what we do when there's prostate cancer, radical prostatectomy. Here, the goal is to save your life, to cure the cancer, and to do that, we remove the entire prostate along with the seminal vesicles. It's like demolishing the whole factory, not just emptying it. When we remove these organs, semen production disappears completely. No factory, no production. Therefore, after the surgery, there's no ejaculation at all. You can still feel orgasm, what we call a dry orgasm. That sensation of climax, of pleasure, but there won't be any fluid expelled. And I have to be honest here, this surgery is much more complex and has two significant risks I can't ignore. Urinary incontinence, losing control of your bladder and erectile dysfunction, difficulty or inability to get erections. This happens because the nerves responsible for erections run right alongside the prostate, like electrical wires next to a wall, and they can get damaged during surgery. I had another patient, let's call him James, 65, diagnosed with prostate cancer caught early. He looked at me with tears in his eyes. Dr. Brooks, is it worth living like that? And I answered with complete honesty. James, the question isn't whether it's worth living like that. The question is whether it's worth living. And with modern techniques, robotic surgery, millimeter precision, we can often preserve those nerves. We can save function. Not always, but often enough that there's real hope. Now, I know some of you watching this are thinking, okay, Dr. Brooks, this is all great, but I'm 70 years old. Who can ejaculate 21 times a month at my age? And that's a totally fair question. I've seen it in the comments and it's valid. Here's the reality. That number came from a study of men across all ages. Younger guys might hit 21 easily. Older gentlemen might be at 5 or 10, and that's completely normal and healthy. What matters isn't hitting some arbitrary number. What matters is being sexually active relative to your own baseline, whatever that looks like for you. Some of you asked about diet. Can I eat papaya one day? Guava the next, mango after that? Absolutely. Fruits rich in antioxidants, especially those with lycopene like tomatoes, watermelon, even pink grapefruit. These are great for prostate health, but there's no magic fruit that'll cure everything. It's about overall dietary patterns. More vegetables, more fruits, more fish, less red meat, less processed junk, less sugar. And for those of you who asked about women's health and masturbation, yes, there's evidence that sexual activity is beneficial for women too, especially postmenopause. But that's a whole other video. And honestly, I'm planning to make one specifically about that because the questions have been pouring in. Someone asked, is it a bad sign to feel pain in my pelvis when I ejaculate? Yes, that's something you should absolutely get checked out. Pain during ejaculation can indicate prostatitis, inflammation, infection, or other issues. Don't ignore it. Book an appointment with your doctor. After everything I've shared, after all these facts, all these stories, all these fears and hopes, I want you to walk away with one crystal clear, powerful idea. There's no magic formula to prevent prostate cancer. There's no miracle diet, no secret supplement, no magic number of ejaculations that'll guarantee you're safe. The most powerful tool you have, the only one that can really make the difference between life and death, is prevention through regular medical checkups. Getting your annual exam with a urologist, measuring your PSA, that prostate-specific antigen everyone talks about, doing the digital rectal exam when your doctor recommends it, even though it's uncomfortable and embarrassing. That's what can actually save your life, because it allows us to detect any problem when there's still time to do something about it. Robert came back for a follow-up a month after our first conversation. Dr. Brooks, he said with a smile, I booked my appointment with the urologist, and you know what? I'm not embarrassed to talk about this stuff anymore. I told my buddies at the Legion, and turns out they all had the same questions. We're all going to get checked together. That's it, Robert, I told him. That's breaking the silence that kills. Now, maintaining regular ejaculation frequency seems beneficial. The studies are clear on that, but take it as one piece of a much bigger puzzle. What are the other pieces? The ones that have been scientifically proven to be crucial. First, don't smoke. Tobacco is poison for your prostate, your lungs, your entire body. If you smoke, quit. Not tomorrow, not next week. Today. Call the Canadian Cancer Society's Smokers Helpline. They've got free resources. Second, maintain a healthy weight. That beer belly isn't just a cosmetic issue. It's inflammation, it's risk, it's disease waiting to happen. And I say this with compassion because I know how hard Canadian winters make it to stay active. Third, eat well. More vegetables, more fruits, more fish, especially that good Canadian salmon. Less red meat, less processed foods, less Tim Hortons donuts, though I know that's tough for us Canadians. Your prostate will thank you. And above all, move sedentary lifestyle is one of the biggest enemies of your prostatic and general health. You don't need to run marathons. Walking 30 minutes a day, taking the stairs, shoveling snow in winter, playing hockey with your grandkids, it all counts. Tom told me once, Dr. Brooks, since I started walking every morning around the neighborhood, not only do I pee better, I feel 20 years younger, even in February. Now, a warning. Be very careful with internet charlatans selling miracle cures, magic potions, expensive supplements, treatments with no scientific backing. Health is serious, too serious to leave in the hands of snake oil salespeople. If someone promises to cure your prostate with green smoothies, magnets, crystals, or anything not backed by science, run. Don't waste your money, and more importantly, don't waste your time. When it comes to cancer, time is life. Every day you delay proper medical care chasing fake cures is a day the disease could be progressing. After 20 years in this profession, after seeing thousands of men come through my clinic here in Toronto, I've learned something fundamental. The men who age best, who reach 80 with a smile on their face, who still enjoy life, aren't the ones who found some secret formula. They're the ones who took control of their health, who weren't embarrassed to ask questions, to talk openly, to take care of themselves. Your prostate isn't your enemy. It's part of you, and it deserves care and attention. Regular sexual activity, whether with a partner or solo, seems to play a protective role. But it's just one piece of the puzzle. The complete picture includes regular checkups, healthy lifestyle, good nutrition, exercise, stress management, and most importantly, breaking the silence around these topics. So here's what I want you to do right now. If you found this information valuable, if this answered questions you've been too embarrassed to ask, hit that subscribe button. Share this video with a friend, a brother, a father, someone who needs to hear this. Leave a comment below telling me what surprised you most or what questions you still have. I read every single comment, and your questions help me make better content for all of you. And most importantly, book that appointment with your doctor if you haven't had a checkup in the last year. Call tomorrow morning. Your future self will thank you. Remember, taking care of yourself isn't something to be embarrassed about. It's the most masculine thing you can do. Stay healthy out there, everyone.